We all have a story. Where we come from, who we are, what we want in life, dreams and hopes for the future. In Nicaragua, many families live a similar story. A story that finds them struck with poverty and struggling to meet every human's most basic needs: adequate housing, food, education, clean water, and healthcare. At Amos, motivated by our faith, we are committed to working towards a world where every person has health and hope. Even though we may not be able to change what's already written in their stories, we can and will help them write new, brighter chapters. Amos was founded in 2007 as a Christian nonprofit that exists to reduce health inequities in Nicaragua by empowering local leadership to prevent disease and save lives. We believe in helping to build sustainable solutions to community-identified problems together with the community themselves, using participatory and evidence-based methodologies, as well as measuring and evaluating our results to learn and improve our programs. We are part of their stories as much as they are part of ours.
Petronilo Gaitan, a health promoter in the rural community of Fila Grande in Matagalpa, is one of the many community leaders in this story. For years, his community struggled with emergencies they weren't prepared to handle. Pregnant mothers without access to care, accidents in the field, families with no nearby clinic or medicines, children falling ill to diarrhea, pneumonia, or fever. Tragically, some of them did not reach their 5th birthday, and some moms died giving birth at home. Now, thanks to Amos' support to health units, Petronilo and other health promoters have the knowledge and tools to respond effectively and help save lives. In times of critical need, they coordinate emergency transportation, mobilizing neighbors to carry loved ones to the nearest health center miles away. They also work closely with volunteer mothers who are trained to recognize signs of alarm during pregnancy, postpartum, and early childhood. Together, they promote healthy practices such as breastfeeding, balanced nutrition with local foods, and early childhood development. They also educate mothers on the importance of giving birth at a health unit, where health professionals can quickly act if there are any complications. These efforts contribute to the national strategies led by the Ministry of Health and are helping prevent maternal and child deaths, enabling children to grow strong and healthy with the opportunity to live full lives. In rural communities, local health leaders like Petronilo are at the heart of change. Another of these leaders is Leila, a young woman studying nursing thanks to the Seeds of Hope scholarship. As a child, she grew up seeing her grandfather taking care of children and pregnant women, which not only inspired her dream of becoming a nurse, but has led her to take concrete actions for the well-being of her community, serving as a water sanitation and hygiene promoter. Leila knows that many families in rural communities still drink water contaminated with bacteria and other harmful substances. During the rainy season, water sources may be inaccessible or dirty. That's why, together with Amos and other local health leaders, she helps bring water filters to these homes. But more importantly, she teaches families how to use and care for them. An essential part of her role is educating families to foster long-term habits of clean water and hygiene practices, to prevent illness and ensure that every child and pregnant mom have access to something so simple, yet so essential and life-changing: safe drinking water. Miles away, in the remote village of Banco de Siquia, René serves as a sexual and reproductive health counselor. He has seen firsthand the impact of teen pregnancies, often leading to an early halt in education, limiting future opportunities and deepening cycles of poverty. René, a father himself, cares deeply about creating a better path forward for his children and his community's youth. Through Amos, René is learning how to educate others on safe family planning, prevention of sexually transmitted infections, reproductive and sexual rights, and the importance of shared responsibility in planning how many children to have and raising them. He also participates in health fairs that bring the whole community together to receive medical care from Amos and the Ministry of Health, and offer a perfect setting for educational talks on sexual health and prevention of gender-based violence. By sharing his knowledge and life experiences, René is helping others make informed, empowered choices. His story and those of the people he's mentoring is one of courage and hope for a better future. In the capital of the country, Amos urban clinics are a haven of hope for many. The Samaritan Clinic in Nahapa and the Villa Guadalupe Clinic in an area near the city dump serve as lifelines for families living in poverty in these neighborhoods. Here, patients find more than medical treatment. They find compassionate care. Our doctors and nurses serve vulnerable children, patients facing chronic illnesses such as diabetes and hypertension, and pregnant mothers in need of prenatal care, offering curative and preventative services for free, including general medicine, pharmacy, pediatrics, laboratory, ultrasounds, gynecology, and dental care. And in our community of Nahapa, our Samaritan Clinic works in coordination with the community health volunteers like Martha, who helps her neighbors manage chronic illnesses including diabetes and hypertension, meets with them regularly to counsel them on ways to stay healthy and avoid complications, visits them to check their blood pressure and glucose level, and advises them on signs of alarm and when to seek urgent medical help. Together, they create a network of care that empowers individuals to live their lives with dignity and health, a reminder of the power of community to sustain hope.
Every life we touch adds a new chapter to a greater story of hope, resilience, and transformation. Together, we are not just observers, we are active participants in rewriting the future for countless families in Nicaragua. But this story is far from finished. There are more chapters to write, more lives to impact, and more hope to bring. We invite you to join us in this mission. Whether through your prayers, your support, or your hands-on involvement, you can help us turn the page to a brighter future. Be part of this story. Together, let's ensure that the next chapter is one of health, dignity, and opportunity for all. Your story, ours, and theirs are intertwined, and with your support, we can make a lasting difference that will be felt for generations to come.